But it was great. Patty, I'll send you over some photos.
Okay, that'd be great. Thanks.
Yeah.
Okay, I'm going to check. Do we have a quorum? Do we know? Do we have, we've got a, Jordana says we have a quorum. Do we need a roll call? Remind me. Do I need a roll call? Or can you?
So Lindsay Douglas is graciously, we're a bit short-staffed in the admin side today. So she is taking notes and running the Zoom. So just a heads up to allow a little bit of grace and space if we're making sure that she has time to record any decisions and moving us between screens. But Lindsay, let us know if you're good for us to move on, because I think she can see everybody's names and get roll call that way.
And Lindsay, you can chime in as well with me if you need a pause or anything there, as anybody can who's with us on the panel. Okay, we're going to get started. It's 1:01, so I think we can get started. This is the November meeting of the Pitkin County Board of Health. If we have a quorum here, and I guess we can take a roll call. I guess that's what I should be doing to be. So Krista is here. I'm just going to hear Bill.
I'm here.
Tori. Jeannie, I see it, Tori, you're good.
I'm here.
Jeannie's here. I'm just going through my list. Linda's here. Thank you, Linda. That's all I've got right now. Are there?
Don't forget me.
Patty's here. Is that a quorum? Seems
No,
kind
I'm
of
not
thin.
part of the forum. I'm just a body.
Yeah,
on
you're
the-
not. I'm not sure if we have all, there are a few members missing still, aren't there? I know Kim Levin said she can't, probably won't be able to make it today from our advisor.
The
And
other
Mark-
voting member is Tom Kurt, right? Dr. Kurt.
Dr. Kurt's not here. Markey is also not available today. So I just want to make sure we're.
But we don't
legal and
have
ready.
the alternate either.
We just need four members to hold the meeting, and we've got more than that for today.
We've got them. Okay, so thank you. Reviewing the agenda today. I don't know if I need a motion for approval of the agenda, but why not? Accept a motion. So we see, I see a motion from Krista. I'm looking for
I'll
a second.
second.
Okay, and that was
Jeannie.
Linda. Oh, Jeannie, thank you. Okay, all in favor, raise your hand. And we're just going to keep on moving. All right. Corrections and approval of previous minutes. Any conversation about previous minutes, or anybody'd like to make a motion?
I'll make a motion to approve the minutes.
Krista, okay. Krista moved. I need a second.
Second.
Okay, second from Jeannie again, I think. All in favor, raise your hand. Right hand, we're good. From I see, thank you. Okay, so now to the business at hand. We're 2 minutes ahead of schedule, and we'll probably take it all up. This is presentation of the proposed winter mitigation plan. So I'm going to hand this over to Jordana. And I think this is going to take up, well, we're going to go to discussing after. So let's let her get it all out first, and then we're going to have a robust discussion and get all our questions. So take it away, Jordana.
Thanks, Greg. So just to ground us back in this winter mitigation plan and the trigger document discussion, why did we start down this path? So the community has really been asking for predictability of mitigation measures over the winter time season, wanting to know what they can expect, what those triggers are for, and then what mitigation measures would be associated there. Last winter we had the COVID dial that was from the state level. There was a lot of movement because that dial was based on incidence rate from one thing to another. And there were definitely challenges with moving from one level to the next with communication and changes. And so we've taken all of that into consideration for how we should approach winter this year. One major change is we're really managing to hospital capacity, knowing that is what we are aiming to maintain. We have made some of our triggers very distinct and very tied to when we know the hospital is having capacity issues, and then appropriate mitigation measures to try to be able to protect that. As well as we've made some recommendations for triggers around the wintertime season, knowing that we have increased mobility, more people are going to be inside, and that we would expect to continue to see an increase in incidence just due to those factors. How can we preemptively know that that's happening in our community? That does depend so much on visitors, and put those mitigation strategies into place in a time-bound way over the winter time. The other thing that is addressed in this winter mitigation plan is that we have tools that we didn't have last year. So we have vaccination, and that is incentivized throughout this plan. As well as we know that masking is incredibly effective. And so that continues to be a mitigation strategy that can help us reduce transmission, control transmission, and protect that hospital capacity. This slide here just outlines the whole process that we've been through with developing this winter mitigation plan. You'll see that right now we're on this last step here, is to present the final recommendation for the Board of Health consideration. And then today we'll really be asking for a decision from the Board of Health with how to proceed. Next slide, please. So this is the final plan that we'll be presenting to you today. There's been a couple small changes that have been made since last time. And my goal today is to be able to walk through each of the different triggers and mitigation strategies in more detail with everyone today. And also on the call today is Dave Ressler from ABH, who will be able to help us understand a little bit better some of the triggers and thinking behind those triggers and how we operationalize those triggers with the definitions and the importance of that to ABH as we get there. Next slide, please. So the first thing I wanted to share was the community feedback that we did receive around the plan that was put out there this past month. So we had two main strategies. One was we opened up a public comment form, a survey that anyone could click into and give us some feedback. And then we also presented to an ACRA sector meeting and got some industry specific feedback. For the public comment, we had a total of 68 commenters. 10 were for the proposal. 10 indicated that they were for stricter measures, such as vaccination verification in all settings or in restaurant settings, vaccination and testing requirements, or things of that nature. There were 36 comments received against the proposal. Those ranged from everything from not agreeing that masking or vaccination was an effective strategy, to having other reasons for not wanting vaccination or masking to be, not thinking that it was a government's job to do that. And other comments along that vein of thinking that this should just be individual responsibility at this point. The other comments were kind of mixed or not really able to be categorized. And all of these comments are linked in that in the document that was sent out ahead of time and is available on the agenda to anyone who wants to go and read through all of those comments in detail. So those were made available to this Board of Health on Tuesday. The ACRA sector meeting, we really received most feedback around how to communicate the risk level with businesses, as well as how to communicate better and in really creative ways, the requirements with visitors. So we can touch on that more as we delve into that traveler responsibility code piece of the mitigation strategy. The other comment that was received on behalf of ACRA was that there was an ask for reconsideration of the mitigation strategies associated with the crisis standards of care. So the ACRA stated that they'd prefer 100% vaccination to travelers returning home and only essential businesses operating in lieu of what is currently proposed, which is basically back to a shutdown. And as we get into that, we'll have I can explain, or Dave Russler can help explain what it really looks like if we're getting to that point where our hospital is implementing crisis standards of care, and why the ask there, or what is proposed, is really that we can't handle anyone else in the community at that point in time. So before I move along, I'll just pause there, Greg, if there's any questions about the feedback.
See any questions? Dr. Kurt, welcome.
I would point out that 68 people is not really a valid number for sampling epidemiologically the population in Pitkin County. So it's nice to do the survey, but I don't really attach a lot of validity to that epidemiologically and scientifically.
Thank you. I appreciate your comment. I see people nodding in agreement. I was going to make the same comment that that's a very small sample size. So anyway, moving on from there. Other comments? I'm looking for hands up. I'd chime in. I don't see anybody, but Jordana, why don't you continue?
Okay, great. As Lindsay pulls up the next slide, we'll move into the first trigger of substantial or high transmission and the current indoor masking mandate. So if we look at the next slide, I've pulled a snapshot from our website, which really explains our current indoor mask order. It explains that if we are in, let's see, if we're in high or substantial transmission for 5 consecutive days, that's the trigger for going into this measure where we currently are. If we are in low or moderate transmission on that COVID-19 CDC data tracker, that then we would come out of that mask requirement. You can see here we're tracking how many days we've been in substantial or high since September. It's been 2 months where we have been in that level, and so this is intended to be in place until we meet those other metrics. Next slide, please. The one thing I did want to share, Josh has updated this slide from what we saw last time we came together. It was updated through October. Now we have data through November showing that our incidence rate in Pitkin County, which is the blue line, since we implemented the mask order in mid-September, has decreased slowly but steadily, especially when we look at it in comparison to the incidence rate across Colorado, which we all know continues to increase, which is continually putting this pressure on hospitalizations across the state that I'll talk about in a little bit as well. So just wanted to continue to share this data, and that really is in support of the effectiveness of the mask order and what we're able to achieve with it in place. Next slide, please. The other piece that this is also available on our website is for those fully vaccinated facilities programs. So if we're continuing to know and promote this program, especially in venues or situations where people aren't able to be masked or where it's challenging, like gyms, like restaurants where people are eating and drinking. So we know, again, that vaccination is one of the most protective things that we can do to reduce transmission, and we continue to urge those facilities, especially where masks are not able to be worn at all times, to be able to consider becoming a fully vaccinated facility. This is where both employees as well as anyone coming into that space, patrons, visitors, there's a way to be able to check vaccination status. Currently, we have 33 businesses that have been certified under this program. Next slide, please. Again, just a little bit more data to show that what we know about vaccinations being incredibly effective in this pandemic. This shows the correlation between 14-day COVID-19 hospitalization rates and vaccination rates among the biggest counties in Colorado. But what you see is that clear correlation that the more vaccinated your population, the lower your hospitalization rate is, which is really what our goal is. We're trying to create policy around. Next slide, please. These are some more slides that from the state that I wanted to share with the board to understand the current situation. So hospitalizations across the state are continuing to increase very quickly. As you can see from the steepness of that line, most recently on the right-hand side, we are seeing hospitalizations increase. We are over 1,400 hospitalizations due to COVID across the state. And as you can see, back at the peak last winter, we hit over 1,800 hospitalizations due to COVID. If we look at the next slide, we can see that we are, hit that next slide, Lindsay. Oh, thank you, Lindsay. So this next slide shows that obviously as our COVID hospitalizations increase, the total beds available for COVID or any other conditions decreases. So currently there are less than 800 hospital beds across the state available and open. If we look at the next slide, the other thing that we see is that the current trajectory, the current modeling of hospitalizations, they're expected to exceed the peak that we saw last winter. And so this slide does show the slight variance that can be expected with an increase in booster uptake within the population. But we also know that there are other non-pharmaceutical interventions like masking, like distancing, that make a big difference and can help impact not hitting these peak hospitalizations. I think we're doing our part here in Pickens County, but I think the conversation continues to be how can we advocate for this at the state level. Next slide. I'll pause there to see if there's any question with the current mitigation strategy around indoor masking.
Greg, I have a comment.
Sure, go ahead, Patty.
In looking at, I know that it's for the public that's probably on this meeting, and looking at, the fact that, we're seeing our numbers have come down because of masking, and the public will, there's a lot of input as to, well, we also had a decrease in visitors. But if you look at Eagle County or other places, Eagle County that also has the same kind of tourist population that we do, they don't have masking and their numbers have not come down like ours. So I just want people to know that it's taken into consideration that we don't have the tourism numbers we have now, but also we're looking at then the fact that our masking has had an influence on our numbers being lower. Just wanted to get that out there for the public.
Great, thank you, Patty. I'm looking for anyone else who may have a comment.
Can I ask a question? This is Krista.
Krista, yeah.
Just back to that, Jordana, the triggers for, I don't know if the trigger is the right word, but the indications for following the CDC when we go to no masking due to a lower incidence rate. Is the school on the same plan as the community for that?
So the school, great question. the school mask mandate is a bit separate. Their requirements are by building. So any facility that's associated with a school would need at least a 70% vaccination rate of everyone in that building. The incidence rate in the community would need to be at that low or moderate level, so below 50 per 100,000. And then that facility would need to consult with public health to be able to repeal the mask mandate in the school setting.
Thank you.
Okay, I'm looking for other comments or questions. If I don't see you, please raise your hand. I just wanted to ask, looking at the curves, we went through them fairly quickly, but the impression you get is we're on a very steep acceleration of incidence rate in the state. Hospital capacity is already critical. So what preparations have we been hearing about from the state regarding additional hospital capacity? Because it looks like it's pointing toward the need based on these curves that we're going to need additional ICU or critical care capacity than we have in the state. Is that the track we're on? And am I interpreting that correctly?
That's the track that we're on. The governor has ordered 500 new beds to be made available in the state, and is looking for staffing to help come in from other outside sources, because we know also we may have some beds, but we don't actually have the staffing to be able to take care of patients in those beds. So that's a move that's being made at the state level. The governor wrote an executive order stating that anyone 18 and older is eligible for a booster dose. So CDC guidance outlines specific criteria, one of that being if you're at risk due to your job or setting. And the governor has argued that because of the high incidence rate across Colorado, every Coloradan should consider themselves in that category, and therefore boosters are to be made available to anyone 18 and older who still meets the time period requirement, since their full dose regime is in place. And then thirdly is the state is really looking at increasing the access to monoclonal antibody treatment, which is very effective at treating early treatment for those that have tested positive for COVID who are at increased risk. If you catch it early, if you're tested and you know that you're positive early enough, and you can be treated with monoclonal antibodies, there's an increased chance that you won't be required to be hospitalized. It'll keep you out of the hospitals. And I know that treatment is available at BoH, and I see lots of doctors on the call. So if there's anything else that they want to say about that, I'll let them chime in.
Yeah, so basically Governor Polis is making it available to urgent cares. I have been ordering this like crazy. I mean, Fruita, Grand Junction, Grand River, which is over in Rifle, Valley View, Eagle, everybody has it. Urgent cares have been giving it, and we've just been ordering it like crazy. And it is keeping people out of the hospital, which is, again, everything we're trying to do.
Can I ask a question about the 500 additional bed capacity? Assuming that's all Front Range, or is some of it happening on the western slope? Do we know?
But it's throughout the whole state. But Greg, the big problem is we have a lower rate of ICU beds than we did at this point last year during the pandemic. Unfortunately, we've lost staff for all sorts of reasons. One may or may not have been the vaccine mandate that was put out, and we lost some nurses that way. But we are about 400 beds shorter than we were at this time last year. I mean, Dave Ressler probably knows this better than I do, but it is a huge staffing issue.
Got it. So I just think that the salient message that I want to make sure we hear is that while we're looking pretty good in our community, we're doing the right things regarding masking and vaccinations. Our hospital seems to be okay, but the support structure elsewhere in the state is where we're seeing, weakening and less availability. So if you're thinking you're going to get sick here, then get shipped off to Denver, that may not work. That may not be an option. Because I know somebody will have to tell us how many people who do get sick end up having to be sent to Denver or lower elevation. But if that's not a possibility, let's contemplate their options. I don't know if it's a rhetorical question, but I'll put it up. Dave can talk about it if he wants to.
Sure.
Anything else? Oh, there he is. Great. Thanks, Dave.
Would you like me to speak to that now? Okay. The last number of admissions we've had have been able to be managed here at altitude, largely because they have not required mechanical ventilation. So we can implement that here for our patients that require it, but it's not in their best interest to stay here. Those are the patients that we will ship to a higher level facility at a lower altitude. And exactly to your point, we're part of a system of hospitals in the state, and that is where the concern comes in as to whether or not at the time that transfer would be indicated, would we be able to accomplish it within a reasonable period of time. We are hearing about significant delays on the part of rural hospitals trying to transfer patients down either to Denver or to Grand Junction. Right now, Grand Junction, St. Mary's Hospital does not have any available beds.
Got it. On that note, Dave, is our hospital able to expand number of beds for critical care? Is that a possibility here to increase our bandwidth a little bit? Because I'm not sure exactly how many you have, but it's a pretty small number before we're in a bad situation.
The answer is yes, that we have a what we call a surge plan, which then utilizes all available resources as we need to. Our ideal or our what you might consider to be the most appropriate use of our beds is 4 intensive care unit beds and about the same number of ventilators, although we also have a transport ventilator or possibly 2 that are become a rate limiting factor when patients become that sick and we can't get them into another more appropriate higher level facility. But we do have additional beds beyond the ICU that are negative pressure, thanks to our expansions. But again, if they require mechanical ventilation, that's not solving the problem. So it really depends on what the patient's specific needs are.
Great, thank you. I'm going to keep the floor open for questions, and then Jordana, I'm going to hand it back to you. Oh, Dr. Kirk.
I'd like to point out that we need to anticipate Thanksgiving, which is coming up in 2 weeks. It's nice to look at the status quo, but let's anticipate the future. I think that the Pickens County has been doing compared to, say, Eagle or Mexicana exceptionally well. But on the other hand, let's anticipate Thanksgiving. I would point out something that might mollify that is that we had 2 major restaurants closed. You know, Jimmy's is closed for remodeling as well as La Hosteria. And since cases do come from restaurants as 30% of the source, perhaps that might sort of mollify the beginning of this.
Great, thank you. I'm looking for others. I don't see any other hands up. I'll hear from you. Tori.
Yeah, just real quick, wanted to follow up on what Dr. Kurt just said. And this is more of a question for Jordana. Dr. Kurt just alluded to 30% of case transmission coming from restaurants. Is that data that is new, or where's that come from? And is that correct?
I might pull in, wondering Kurt or Josh, or Dr. Kurt, if you're looking at the outbreak data.
Yes, that was the breakdown of Josh's data in the last report. You know, the breakdown of where cases were coming from.
So we do have data on the website, and Josh, or if you can pull that up. I think that might be since the beginning of the pandemic, we've been tracking where cases have been pulled back to, and I can't recall right now if it's all cases or outbreaks. That the 30% is what Dr. Kurt's referring to.
Okay, we can look forward to that when Josh gets it.
And I appreciate that. The only reason I want some clarification there is because some of the items that we're looking at on our triggers and releases is that correlated restaurant capacity, I believe, with hospitalization availability and stuff like that. So I just want to make sure that the measures that we're taking are kind of justified by the data that we're receiving. Thanks.
Thank you, Tori. Thanks for bringing that up. Okay, Mayor Madsen.
Yeah, just a question for Mr. Ressler. Do we have stats on how many patients have been transferred out of ABH?
We do. I don't have that in front of me. I'll look that up. Since the beginning of the pandemic, do you mean, or within a more recent period of time?
Well, I think both would be helpful, but I mean, if you have the recent stats, that would probably be helpful as well.
Okay, let me look that up. And by the way, with regard to my earlier comment, we have 2 ventilators, transport ventilators. I said 1.
Yeah, great, thanks. You said 1 or 2, so I had you down for 2 already. Thanks.
Oh, good. You took the high side.
And Greg, I did just get a response from Josh that it's 29% of all reported outbreaks throughout the pandemic have been restaurant associated.
Great. Good to know. That's sobering, restaurant community. I hope everyone's listening. Anecdotally, I think it's pretty easy just to take your mask off and leave it off when you enter a restaurant, and that may not be the best thing to do all the time. When you're eating, obviously you have to. Okay, Jordana, keep on going.
All right. So as Lindsay pulls the slides back up here, we'll see that this next mitigation, go back 1 slide. So we'll be talking about these mitigation strategies that are associated with the time-bound winter period of December 1st through May 1st. So we've got 3 pieces. And next slide, please. The first is the event safety plan. As it's written into the public health order at this point, as of December 1st, an event safety plan would be required for events with 50 or more people. The purpose is really to help event organizers identify and manage the risk of COVID-19 for all of the different types of events and activities in a variety of different settings. So it sets out the process for working with Pickens County Public Health to be able to have an event that is COVID-19 safe. The objectives are to outline the public health considerations and requirements to support the event organizers in helping to plan these kinds of events, to enable the community to engage in these events as safely as possible, as we know that the COVID-19 environment is currently changing. And then finally, to support the social and economic recovery of the community by supporting our vibrant and unique events in a way that's as safe as possible. So next slide, please. The event safety plan has 3 main steps. The first is to reference relevant requirements. So it really outlines what are you required to do when you're planning an event with the indoor mask mandate during substantial or high transmission. Number 2 is to assess the risk. So it really has the event organizers look at the event setting, the length of the event, the number of people attending, the activities during the event, right? Is it inside? Is it outside? Are people standing or sitting? Are people eating? Do they have to take off their masks at any point in time? And then consider what are those mitigation strategies that can be layered to promote as much of a safe event as possible. So testing and vaccination policies, how to reduce crowding, how to support hand washing, ventilation, and communication. So knowing that we've got mitigation strategies beyond vaccination and testing and masking, making sure that all of these are fully considered to be able to host a COVID-19 safe event. Next slide, please. The other mitigation strategy in this time-bound winter period of time is the Traveler Responsibility Code. So this is already up on our website and outlines the goal of the Traveler Responsibility Code, which is keeping businesses open, keeping people employed, providing being able to have schools continue to be open, protecting those most at risk in our community, continuing to support our hospital and medical system capacity, and enabling us to have a healthy winter so our ski resort and associated businesses can stay open. It outlines the travel requirements and guidance from the CDC, and then also highlights our local requirements that you can read there below. The requirement here that's currently written into the proposed public health order is that those in the hospitality industry who are reaching out to travelers are sharing with this with those that are traveling to Pitkin County so that they know what to expect when they do come here. Again, last time when we really talked about this was seen as a benefit, especially to those frontline workers. So they're not the first ones having to tell people all about the rules once they get there. As much as possible, having this out there so people are knowing what to expect before they get here. And then even if we do miss some, having this available at the front desk, having this as a communication tool for all of those frontline hospitality workers has been seen as a benefit.
A question, Jordana. How well has this been received in the hotel and restaurant community, our travel industry community? Do we have, maybe Patty would have some insight on that from ACRA, or how is this being taken? Do we think this is being disseminated to potential visitors?
I don't think it is yet. I think that there has been the changes we've made since last year that we think will make this even more helpful. Last year, we went, if you remember, from the traveler affidavit program, which required information saying I attest that I've done all of this, to the traveler responsibility code, which still required an attestation of some certain things. This year, this is really being proposed as a communication tool, which if you remember from the feedback from ACRA, we were getting that how ACRA and businesses in the hospitality world are really interested in what are the ways that they can help communicate with people before they get here, so that it's not all being put on their frontline staff. So Greg, to our knowledge, the tweaks that we've made to this, as well as the ability to work together with our communications team and those in the hospitality industry, is what we're hearing there is interest and support from locally.
Great. If I can throw this in, just thinking about the next large, pulses of people coming here with maybe Thanksgiving, and then X Games pops up. Do we know if all the kids who are going to be attending X Games are ever going to see something like this before they come to town? That's going to be a tough one for Ski Company or ESPN or whoever's in charge over there for that event to push out. But I think it's important. And I think we should be able to measure that somehow. I'm hoping that they can respond to that. Dave Ressler just sent us a text just saying that we've had 68 patients transferred since the beginning of COVID, 64 of which from the emergency department, 4 from inpatient status. The most recent was on October 25th of this year. That's Bill, that was for you, Mayor Madsen. So we've had to send 68 patients out, and hopefully that will help us. Anybody who's contemplating, what the next steps are if you get sick in Aspen, where the option of not being shipped out would be pretty daunting. All right, Jordana, I don't see questions, but yell if I don't see you.
Okay, the next slide just talks about the fact that we will be updating. Lindsay, if you can go to the next slide. We will be updating our business playbook for 2022 to include some more updated information, which we'll also be pushing out to businesses. So businesses can be thinking through similarly mitigation strategies, vaccination policies, and the like. Next slide, please. That brings us through the review of those time-bound winter mitigation strategies. Any questions there?
I'm not seeing questions. I would love to ask, just for comparison, what's happening elsewhere in the world or in the country where we could compare to how people are approaching this? I know European countries have very stringent measures regarding masking and regarding presentation of proof of vaccination. So I think we're nowhere near as stringent as they are. My personal feeling is that we should probably be doing more, but that doesn't seem to be the culture here. Do you have any other comparisons you can share with us?
That's for me. No, I haven't put together, a comparison. As you say, it depends on what county you're talking about, what municipality you're talking about, which European country you're talking about. That there's, I'm sure that we could all give a different example of a different policy that we know about, or a different approach that's being taken.
Right. Thank you. Okay. So we're finished with your presentation then? Are we on to the discussion among?
We've got
Oh,
two
sorry.
more.
Okay.
Final two triggers have to do with our hospital capacity. So the first trigger is suspension. If there's suspension of all elective surgeries at the discretion of Aspen Valley Hospital, then the mitigation strategies accordingly would be put into place. To go into a little bit more detail on this trigger, we have recently, this is one of the triggers where we've updated a little bit the language around there. If you've noticed, the governor very recently has suspended all cosmetic surgeries across the state. And so it got us talking about the trigger here, and if that were somehow imposed statewide, saying across the state, all hospitals are required to suspend elective surgeries, that would not trigger our mitigation strategy to go into place. It would need to be at the discretion of AVH. So it would need to be AVH saying our hospital capacity is challenged in such a way that we are just making the decision that we need to suspend elective surgeries locally. And then the mitigation strategy of reducing capacity across the board to 50% indoors, unless there has been a vaccination verification in place where 100% of those in the facility are vaccinated or have participated in vaccination verification, then they can operate at 100% capacity. That mitigation strategy does not apply to schools. It does apply to events. So your capacity would be cut in half unless you're assuring that everyone in that space has been vaccinated. Over to the right-hand side is the more detailed description of suspension of elective surgeries at the discretion of AVH. And I'll just again pause there to see if there's any questions or anything else for Dave Ressler to share.
Krista?
Yeah, Dave, I would appreciate your input on this because I really think this is for the public, but there are currently elective surgeries being suspended in places. I know, for example, the VA is definitely suspending all elective surgeries in Grand Junction. I think that actually St. Mary's and Community have followed. So I feel like some communication around this to the public, just to kind of give guidance on how severe it really has to be for this trigger to come in.
Sure, happy to speak to that. And let me first elaborate a little bit upon the definition that Jordana provided. What we're talking about is a decision on our part to suspend elective surgeries. Dr. Giesel, like that, which you've described the VA and a number of other hospitals have already done. As opposed to if the governor were to issue an executive order, and if you've been reading the papers, I'm sure you've seen that that's on his list of levers that he can pull. And so he is already giving that due consideration. But if he were to do so, it wouldn't necessarily mean that we would need to invoke that level of mitigation in our discussions with Jordana and her team, because our community may still be like it is now, which is not necessarily contributing to the hospitalization problem in the state. But if we decide to do so, to your point, Dr. Giesel, it would be because we are conserving limited resources to be able to take care of presumably COVID patients. And I'm sure people watching this might be thinking, what does surgeries have to do with COVID patients? COVID patients don't generally require surgery. The answer is it's the consumption of our resources and the potential for patients post-operatively to have to be placed in an ICU bed and then reduce that capacity that we would want to keep available. And again, this would be in the situation where we are being inundated with COVID patients that require hospitalization. That's really the point that Jordana and her team are trying to get to, is if the COVID hospitalizations have risen to the level that we must make that move, then we clearly are past the point where we need to start increasing the mitigation measures. The last thing I want to say with regard to your question is, how serious must it be for us to take that step? I've only done it once. That was earlier in 30 years, and that was earlier in the pandemic, and that was here. It is literally cutting off the revenue for the hospital that we rely upon, and the analogy would be cutting off our air supply. So we certainly don't want to do that unless it's necessary to protect the community and our patients.
Sorry, just one more question to follow up, but do you get pressure at all from these hospitals in Grand Junction to look at factors like this? Or is this a decision you're truly able to just make independently as Aspen Valley Hospital?
Well, again, unless the governor invokes it through an executive order, and that would apply to all the hospitals across the state. Aside from that occurring, it's our decision, and we have not received any pressure, and I don't expect we would from any other sources besides the governor's office.
Thank you.
Great. Okay, Krista, or not Krista, but Jordana. Back to you.
I think Dr. Kurt had a question.
Oh, thank you.
And
Okay.
Bill.
I'd like to make the point that I serve on the Wheeler board as well as Mayor Tory, and we have instituted a vaccination policy for all people who are ticketed. If they are not vaccinated, there's a testing on site of the Abbott Binax Now test, which is available, I think, in the range for $25 to $30. So that needs to be taken into account. I think Michael Goldberg at Belly Up has instituted a similar kind of policy. And from being also a volunteer usher at the Wheeler, I can tell you that there has been wonderful compliance with the audience wearing masks inside the Wheeler. And an additional point I would like to make in regard to that is that perhaps considering instituting or making such available at the airport with the traveler affidavit or the traveler advisory at this time might be anticipated for Thanksgiving and help keep people informed as they arrive at the airport.
Okay, I want to get back to that. I think Bill and then Tori. Did you have?
Yeah, so I guess it's more of a question just in regard to procedure, because it's really shifting the burden to AVH from the Board of Health to make that decision, correct? If we're going to pull that lever, if you will, or hit that trigger of going to 50% capacity, that's going to be the hospital, Dave, or his board that's going to be making that decision, not the Board of Health.
Well, right. And that's what, this board was giving direction of saying, let's come up with those triggers ahead of time so that the community knows what to expect and we're not having to make the decision in the moment. We've looked to, I think some of our very original ideas were to tie this to other senses of incidence or, hospital sense of capacity with the hospital capacity matrix. And they were not closely tied enough to what we heard the board saying, want you to focus on when our hospital capacity is threatened. So in effect, Bill, right, it's the board is deciding today if this is the criteria that we'd like to follow, which would then, to your point, very clearly define that trigger and the associated mitigation strategy, but to not continue to come back and have those conversations of, should we do it now? What should we do? To be able to have this time to put this out to the community, have the board be able to think about this and then make the decision ahead of time so that if we do get to that point, we know what to expect.
Great. Thanks, Jordan. Is that answer, Bill? A follow-up?
Yeah, that's great. Thank you.
It seems that what we've done is we're making it less arbitrary. And I think that's one of the biggest complaints we've had. So
Right.
This cuts right down to the brass tacks. Tori, you had a comment, question?
Yeah, thank you. Quick question for Dave at the hospital. Does the winter season and a time where people are on the hill, I assume that we have injuries on a daily basis. Does that impact the hospital availability and elective surgeries? I guess to be a little bit more clear, should we be expecting a postponement of elective surgeries over Christmas, New Year's? Do those kind of run together? Would that be the timing that you'd be seeing that, do you think?
Mayor Tory, no, I don't think there's a direct correlation for the hospital's purposes between the amount of skier injuries and whether or not we would make that move, because we generally don't admit those patients to the intensive care unit. We admit those to our patient care unit, which is not generally where we keep our COVID patients. The correlation, though, that you're mentioning just about the amount of community activity and the potential for a rise in COVID would be one I would refer to Jordana. But for the hospital's purposes, there is not a direct correlation between the two. Does that answer your question?
Yeah, it definitely does. I appreciate that. And then I guess another question for you would be the length of that. And I know that in your long career, you've only done this once, so not a whole bunch to go on there. But if you were to suspend elective surgeries, is that the kind of thing that you would, it's open-ended, I suppose, based on situation, but could it be as short as a week? Or if you were to suspend electives, are you talking like, well, it's probably a 30-day minimum, or?
It would be, well, let's put it this way. The last time we did it, we were following the governor's order, and it was about 45 days that we suspended those procedures, those elective services. I think it could be as short as a week. And I think what we would be looking at then is it's not the suspension of the surgeries themselves that starts to solve the problem. That's just addressing the symptom, which is the demand on hospital services and trying to make sure we can meet the needs of all the patients. It's that it would trigger the mitigation measure that Jordana is presenting to you. And so the question would be, how quickly would that mitigation reduce the demand on hospital services because of COVID? So does that make sense?
Yeah, absolutely. Thanks so much, Dave. I appreciate it. And then I'll just make one last comment. The last time we saw this, this is the area that I had a question about. And I'm so glad that we went out for public comment. Public comment on this is definitely to be taken in consideration, because I'm an elected representative. So what I've tried to do is represent my community and what's best for them, and also taking into account their feelings. But I want to be very clear that I'm not advocating for business. I am not advocating for restaurants. I am not advocating on behalf of economics. But the questions that I have here are because of that correlation So if we go away from elective surgeries and that triggers going to 50% capacities, I just want to know that that is the strong strategy there. I just don't see at this time the necessary correlation there. So I still have questions about this. The council that I'm representing is also split on their feelings here. So I just want to share that. This is a sticking point for me. I just don't necessarily see these two as the maybe appropriate action or not. I just don't know. So I guess what I'm saying is I am all for, if this is the regulation that needs to happen, I'm all for it. I don't know that we need to put it in place with an automatic trigger. I have no problem with this Board of Health getting back together at any time and saying, hey, here's where we are. The hospital has hit the elective surgery mark. Our recommended action is that we go to 50% capacities. I'm still okay with convening as a Board of Health in order to do that and not having the automatic trigger. And I'll also commit and be honest with you, if that's the case that we get to, I will support the action. So I don't know. I just want to put that out there for board consideration.
Thank you,
Thanks.
Tori. Thank you for that suggestion. And if we can, I'd love to hear other board members' thoughts on this. In other words, we'd be convening a Board of Health meeting, an emergency or a special meeting of the Board of Health. If the hospital hits that trigger before it just happens automatically, it triggers our emergency meeting. Yeah, Jordana.
May I also respond to the part of Tori's question that didn't understand how the trigger was related to the mitigation strategy?
Sure.
So I just want to explain that the reason why that mitigation strategy is there and that it applies across the board is that 50% capacity, inherently what that does is distances people, right? So if we're in a space where our hospital capacity is challenged, COVID is spreading in the community, what are the options? We can invoke this capacity, which is inherently spreading people out, or what the business community really honed in on is there is an option for businesses and organizations to continue functioning at 100% occupancy through this phase, and that it can occur by assuring that everyone is vaccinated. What do we know about everybody being vaccinated? Why that strategy works? It is because right now, 81% of everyone who is hospitalized for COVID is unvaccinated. So if that's the pressure that we're trying to relieve by assuring that everyone is vaccinated, we're not going to be having that impact on the hospital. Alternatively, we felt like, we could have just said 100% vaccination, everyone has to do it, but that there was going to be cases where that wasn't going to be possible. So then the option is to operate at 50% capacity.
And thank you so, Jordana, I really appreciate you and the work that you, obviously, I really appreciate you. And I think you're walking a really fine line here, and I think you're doing a great job of it. So I really respect what you just answered with. And I appreciate the opportunity. Last question on that. When you say the 100% vaccinated facilities will still be able to operate at 100% capacity, are you talking just about the ones that are pre-certified for that 100% vaccination, or would there be the opportunity for any business to have fully vaccinated staff and mandate vaccination cards for people to come into their establishment?
Any business
Okay.
is eligible to enroll in that program. It's open enrolling enrollment. As soon as you get the certification, it would apply.
I see a question from Jeannie here.
I just want to make the comment, yes, that in New York City, they're keeping the incidence rates low by requiring vaccine cards whenever you go to a restaurant, bar, or movie theater. And they're doing it in California as well. So that's something we should consider if cases start going up, to try to avoid getting to crisis standards.
Thank you. Dr. Giesel?
Yeah, just to kind of respond to what Tori brought up, I'm not an elected official that's participating on this board, but I do have people from different sectors that reach out to me just because they know me or they know I'm on this. And so I do feel like I've heard from some different, a bunch of different opinions on this. And I also appreciate the public comment, and I really appreciate hearing from our community. And I mean, I think the thing that saddened me the most is I felt like it was very polarized. There was very few people in the middle. They were kind of both on both extremes. I personally feel like one thing I'm hearing is that it was quite hard when we shut the restaurants down last winter, right? Like this was really shocking and damaging to people. And I feel like this is a really important part of why we're doing this work right now. So we don't have to do that again. We don't have to have an emergency meeting and have this very disruptive thing happen again. So that is why I'd be in support of our mitigation measures. And the last thing is, Dave Ressler said this, but I'm going to emphasize this point, is that elective surgery is the bread and butter of that hospital. I mean, to cancel elective surgery, like this has been unheard of in my medical career until March of 2020, right? Like there was nothing that was going to cancel elective surgery. So this is we're desperate when we're at this point in time. Thanks.
Interesting. Thank you for the background on that. Did I see other hands up?
Yeah, it was me.
Ann.
Yeah. So Jordana, in this mitigation strategy, which makes a lot of sense, was there a consideration of modifying the 100% vaccination required to vaccination required or negative test?
Yep, that conversation definitely happened, but yeah, it doesn't get us to that place where, a negative test today could be a positive test tomorrow, right? Vaccination is what we know reduces your chance of being hospitalized. And if what we're trying to protect is our hospital capacity, and to Dr. Giesel's point, if we are at this point where our hospitals cancels elective surgeries, we need to incentivize vaccination as much as possible in order to continue to protect that hospital capacity.
Yeah, thanks for that. And I have heard that before, but again, I think it's important to get that out there again. Thank you.
Got it. Okay. I'm looking for other questions. Not seeing any. Let's move on.
Great. Our last strategy, Lindsay, if you can pull up the slide, our last trigger is even more, if the hospital is in even more dire straits, if you can go to the next slide, actually, Lindsay, it'll give a definition of crisis standards of care. So crisis standards of care are guidelines for how the medical community should allocate scarce resources such as ventilators and intensive care unit beds in the extreme case when patient need exceeds the resources available. So this is if we reach a point, and I'll let Dave Ressler hop in here, where patient needs are exceeding the resources available. This is including resources, not just at ABH, but being able to transfer out to other facilities. If we hit that point, this would be the point at which we can't meet the medical needs of our community, whether that be COVID related or accident, emergent condition related. And so the ask was really to say, how do we get this back under control? And this is where the mitigation strategy would be, again, that stay-at-home order, travelers having to return home, only having essential businesses operate, everything else, events being canceled, and schools even going remote for this period of time for us to get things back under control. And, again, this is something that I know no one wants to see in the community, but really having this discussion with our hospital. It was thought that if we are at this point in time where those crisis standards of care are invoked, this is really what needs to happen.
Just a comment before we hear from Dave, because I was hoping Dave could address this too. But again, I'm hearing from people in the community that they are very concerned because Governor Polis has instituted crisis standards of care in the state of Colorado, right? So they're hearing this language in the community, and this makes them very worried that this is more imminent.
Sure, Dr. Giesel, and thanks for mentioning that. And let me start with that. What the governor's executive order invoked was crisis standards of care as they relate specifically to healthcare staffing, not the hospital crisis standards of care that Jordana's threshold criteria would, or the trigger, pardon me, would references. So the difference is with what Governor Polis has already authorized, it basically frees up. He was able to bring in some FEMA support, some National Guard support, and hospitals were able to apply staffing differently than they normally would. So you might have workers go to a unit where they're not otherwise oriented and familiarized under certain conditions that you wouldn't normally do, but by a hospital operating within those crisis standards of care for healthcare workers, they basically get some protection as they do so. The governor authorizes the crisis standards of care first through an executive order, which is what he's done, again, specifically with regard to healthcare workers. And then each hospital must invoke them themselves by submitting an application to the CDPHE. So it's kind of a two-step process. But to your point, I want to again make it clear, the governor has not authorized at this point hospital crisis standards of care. What's the difference? With hospital crisis standards of care, it's literally a triage function about who gets the limited resources and who doesn't. It's dire. And so I think you can imagine what it must look like for us to utilize those standards. It literally means we have more patients than we can manage. It probably means there's gridlock in the hospital referral system where we can't get any patients out because everybody else is already full and overflowing. So it is that point where movies would dramatize, we're literally walking through halls full of patients and who's going to get those few ventilators. And we have a whole process by which physicians make those triage choices. I think you get the idea that it's at that point to not implement the mitigation measures that Jordana has outlined, I think would be inconceivable.
And just to make this clear to the public too, we have not reached this point before in this pandemic.
Good. Thank you to Dave and Krista. Okay, Jordana, how are we doing? What's next?
Those are all my slides. My next slide is just for Board of Health discussion and decision.
If I could, what I'm taking away from this, I think when I hear, as a layperson, when I hear elective surgeries, I think of all sorts of, the craziest things we've ever heard of for elective surgeries, and I get distracted from what it really means for the hospital and for the community. So having that as a trigger is almost does a disservice if we perceive it that way, but it's much more serious than that. And I just wanted to drive home that I certainly understand it now, and I'm hoping that the community and the media, anybody listening, pushes out just what this actually means, so nobody gets the wrong idea. And if we need to articulate that further, Dave, I'm hoping they reach you and do that if we don't get to it today. The next thing I wanted to point out is that this is giving us an opportunity to be thoughtful. We're being thoughtful now so that we don't go into panic mode later. And I also think that this puts the onus on our community regarding thoughtful event planning and thoughtful operation of their restaurant or their hotel or tourist operations, indoors or out. I think we're being as thoughtful as we can going into this, having had some experience under our belts. Like Dave, we've all seen this once before, and just early on where we had to wrestle with decisions like this. And so I think we're on the right track here. And for those who are concerned that we're stepping on liberties, I think what we're trying to do is be thoughtful in advance of a potential situation, so we all understand where this is going to go if things don't go our way. So there's my spiel before I don't know if we're ready to vote on this, but I'd love to hear other comments as we go, and we have a little time for that. Dr. Kurt?
I think you summarized it well, Dave. We need to focus on preparing for what's happening in the future for Thanksgiving. And I think you, Dave Ressler, Krista, have given us the points on which we need to focus. So I'm in support of proceeding forward.
Great, thank you. Anyone else? Dr. Siebold, Linda, I know is here somewhere. I've seen her name up, but I don't know if she's on. If anybody else has another, Dr. Bill Madsen, Mayor Madsen, Dr. Madsen.
Definitely not Dr. Madsen, but just in reference to Dave's comments there, I think we should change the terminology just so that we have the nomenclature right, so that people aren't confused about crisis standard of care. Since that term is already out there, we should probably utilize a different term so that the public isn't confused about, what our trigger is and what the state is already doing.
Thank you. Interesting point. The governor uses has a different meaning for that, as you pointed out. The question is, Jordana, would that make it more confusing for the rest of the world or less? And what would we substitute it with?
Yeah, COVID's confusing. If that's direction from the board, I'm sure, Dave, we can come up with another term that gets at that same definition. I'll turn it here.
Yeah, if I may, I think just inserting the word hospital, crisis standards of care would be the differentiation. That is what we were talking about with the triage function for the limited resources. So I think that word alone, Mayor Madsen, at least for those of us that are familiar with the crisis standards of care, would be clear.
And Dave, again, just to clarify on that, if the state was put under crisis standards of care for hospitals, this should be triggered in our community too. Like that, it would be that dire for the governor to do it, that it would affect all communities in Colorado?
As I understand it, fortunately, I've never had to do this, but each hospital, what the governor does is authorizes that individual hospitals can then apply for that or submit that that's what they're going to be doing. So I don't know that necessarily, because when we're already at 95% of ICU beds, I don't know if the governor isn't already thinking about authorizing that for some of these hospitals, as you mentioned at the outset, that are already under enormous pressures, and yet we're not. So I would suspect that our public health authorities might want to keep it limited to our hospital invoking those standards.
Agreed.
Okay. Chime in, anybody, if you have. Dr. Siebold. Yep.
Yes, just one point about having the schools go remote. In Europe, such as in Switzerland, before vaccines, when they locked down everything, they kept their schools open because they considered schools to be an essential business. So this may be something we want to look at a little more before making all the schools go remote when the hospital reaches a crisis mode.
So thank you, Dr. Siebold. So Jordana, how would we, I assume your staff would want to contemplate that and figure out how that would work.
We could change the public health order to have that read, consider schools going remote, so that would invoke the discussion at that point in time. And to your point, Dr. Siebold, right, we could see, is there really transmission in the school? Is it something that would be necessary at that point? Or is it something that we could, put in additional strategies and maintain kids being in school because we know how important that is? I think that's a great suggestion.
And would we have the luxury of time to do that? I'm not sure when you'd be contemplating. I guess you'd have to put the plan in place now, so that protocol would be in place. And if this comes up to be a crisis level, are we going to have the luxury of time to think about what the schools should do?
Yeah,
Things are always changing in the schools. The kids are getting vaccinated today, the 5 to 11. So there are a lot of moving parts still there.
Okay, so is that a part of the plan, Jordana? Or do you think is that something do we need to vote on that? We haven't authorized the plan yet. Do we want to amend the plan and vote on that facet of it along with the full plan?
I think the
Yeah, I
last
would-
part needs to be amended. We need to change that crisis standard. I agree with Mayor Mattson, and we need to change the wording on the school.
Okay, so any motion that would come with that, the amendments that have been proposed. Tori, did you have a question or comment?
Yeah, I just wanted to make comment. Again, my preference here would be to use this as a statement from the Board of Health and a schedule of intended action. My preference would be, again, to institute any further restrictions and protocols at this table at the time of that. But I'm not that worried about it. We can do this in this action, because if there were circumstances that change that perception, we heard something else from Dave Ressler, we could always call a meeting together to have that conversation at that time. So I'm either way. I just do share with the board. My preference would be to reconvene the board to put any of these measures in place.
Thank you. Other comments on that? I think that if things became that dire, we'd probably be calling a special meeting in any event. That would be my inclination. But I heard, does anybody want to add that as an amendment? I don't want to corrupt what Jordana's put before us so much that she goes away without what she came for. So I'm looking to you. I think that, if things become as desperate as it sounds, the way we've described this, I'm guessing we would be calling a Board of Health meeting, a special meeting, rapidly. But I wouldn't, if it was on a weekend, or if it was in the middle of the holiday and public health needed to initiate an order, I wouldn't want to hinder that from happening. I don't want to hinder the public health director from being able to make the call. So that my only concern here is that if we're in the middle of a time when just nobody's available, I still want her to be able to work now.
Understood. Thanks, Greg.
Okay, thank you. And I thank you for bringing it up. It all helps bring clarity. Okay, I'm gonna, if there's no more conversation on this, we can do one of two things. We can procrastinate slightly and talk about when our next meeting will be, or I could accept a motion regarding accepting the winter mitigation plan.
I'd make a motion to accept the winter mitigation plan.
Okay.
I second the motion.
And that's with the amendments we discussed.
The amendments we discussed and the final with the schools and in regards to the crisis standards of care language.
Okay, we have a motion
I
from
agree.
Krista and a second with Dr. Kurt affirming the amendments. Further discussion? Tori?
Can we get, I'm assuming that these conversations are happening in some other communities. Can we get some information just dispersed to us whenever we can about what other communities, other ski areas are doing along these same lines?
Thank you. That's super valuable to know what our neighbors and what our peers are doing elsewhere. I think is helpful on many levels. Mayor Mattson, you had a comment as well.
Yeah, I feel very comfortable about moving forward with this because from the outset of this pandemic, it's always been about hospital capacity. So I'm glad that we're moving away from incident rates and really focusing on the hospital capacity, because that's, in my mind, that's really what this is about. So I think we're on the right track.
Thank you for that. That helps. Okay, Ann Mullins.
Yeah, Jordana, it's another request for you. Could you, we heard the amendments, but could you state the exact language, or do you have that yet? Or do you need to work on that for the the two changes or the two amendments to your proposal?
I have, we're amending them in the Google Doc as we speak. So I think you could actually click on that link and see them. The hospital capacity language has really just been updated to include, let's see, it's instead of just crisis standards of care, it now says hospital crisis standards of care. And then the school amendment at this point in time.
We say specifically Aspen Valley Hospital Crisis Standards of Care.
Yes, I can update that currently. And then
Does that sound okay to you?
And then the school language says all PK through 12 public and private schools are required to consider ceasing in-person instruction and activities at school facilities in consultation with Pickens County Public Health.
Perfect. Thank you very much.
And to be clear, that's moving it from an automatic closure to consideration. Thank you. And we're assured we'll have hopefully time for them to consider it. Okay, those are our motions with the amendments. I'm looking for further discussion. If I'll speak now or wait till after the vote. All in favor, raise your right hand. Thank you. I see it looks like consensus on this. Patty agrees. Although she doesn't have a vote, I'm just rubbing it in. Okay, that passed. Thank you. So we've passed our winter mitigation plan. Thank you for Jordana for bringing that forward. And thank you all for the thoughtful amendments. Now we can move on to the big decision that everyone's waiting for is the next meeting, which is scheduled now for December 9th. And I don't know if we need to have a conversation about that. Just put it in your calendars and we'll go from there. I think the next step, we're about 8 minutes early. Dr. Kurt, let's use a little
December
round
the
robin.
9th will be 2 weeks after Thanksgiving with the new influx of tourists. So I think that's a perfect time for our meeting.
Great, thank you. Hopefully the metrics will be really boring at that point. I don't see anybody else here with a hand up. If there's round robin, I'm going to give us 8 minutes of round robin. And then afterwards, I know we have scheduled post Board of Health press event. If any media have questions, I'm going to say for Jordana and team specifically, we will be available to them. Any other round robin issues? I did want to bring up, Krista emailed us, the board, an article. Would you describe that article? If you want to just.
Yeah, it was just kind of an announcement. There was in a few other news sources, but just the WHO was kind of warning the US about this increased rate they're seeing in Europe, which is very highly vaccinated, using these mitigation strategies. You know, things are going up. I mean, literally also in the state of Colorado for reasons that we don't fully understand. So I just feel like it kind of just goes with what we've been talking about, that besides the vaccines and besides the hospitalizations, continuing the non-medical things, which are social distancing, you know, masks, washing your hands. It's really important to continue all of those right now, because again, we are seeing increases in places we did not expect to.
Right, thank you. That's the anecdotal evidence I've seen also and heard from travelers to Europe. Regarding the 33 entities that have done the 100% vaccination, is there anything else you can share about them? They're not all restaurants, I assume. Could you give us a breakdown? And that's a published list too. We could review that list, or anybody could look at it as well.
It's currently, we have a list. It's not publicly available. If people are interested in it, that information can be made available through CORA, Colorado Open Records Act request. But I think generally speaking, there are a number of Aspen Skiing Company types of facilities associated with that align with some of their vaccination requirements that have come out lately and what they'll be preparing for winter. There are maybe 2 restaurants, I think, that are on there, some other concert venues, and then some other, maybe a gym or 2, and then some smaller office type of facilities that have currently applied and have that fully vaccinated status.
Great. I just want to thank every entity who's gone through that and filled that out and is following the protocol. And I want to encourage everybody in town to do that. Every business and every restaurant. I'd feel much more comfortable walking into a place that could say that they've taken those steps.
I just also personally sent it to 2 businesses last night. They were having trouble finding it. So again, it's on the Pitkin County website if you go under the business section, correct, Jordana?
Correct.
Great, thank you. I think that's all the business for the day, unless I have other round robin here. Okay, Tori.
Thanks so much. In this round robin, I just wanted to bring up the item that we've been dealing with in our community that the city has been really tasking itself with, and that's mental health, but also substance abuse issues in our community as well. And I'm just wondering about this board's role in our community health, and if this board has a role in trying to raise awareness, mental health resources, and the like. So just in this round robin opportunity, I just want to bring it forward that COVID is not the only issue that we have in our community for health and safety. So I'm just wondering, and I guess I'm kind of looking at Jordana here because I don't know, it's been so long since we've talked about other issues. So I just wondered, is there an opportunity for the Board of Health to either discuss or start moving on some actions or talk about our community's mental health and substance abuse issues?
Is that a question? That was a question for Jordana. Did you catch that?
I mean, kind of, because I just don't know.
Yeah.
It's been so long since our role has really tackled larger community issues, health issues. So I'm just, if there's any opportunity for this board.
Yeah, Tori. I mean, if we recall, this board did set a priority for 2022, one additional priority in addition to COVID, which was mental health. We have since then had several presentations to this board about what activities and programs are going on around mental health that are being led by the county or participated in by the county. I think that just happened maybe 2 months ago, where we presented all of those mental health arenas. And then Chelsea came back last week and last time, I believe, and talked about the mental health survey to encourage this board to go out and be champions of getting additional responses there so that we can then take those responses and plug those into what our plan is going to be moving forward around mental health. So if there are more specific ways that you see this board being involved in the mental health or have specific interests beyond what we're currently bringing to you, I'm happy to talk about that.
What's the timing of the survey return?
So the survey, I believe, is open until the end of this month. And I can share additional information again out with this group if that would be helpful.
Great, thank you. Please do share that, Dr. Kurt.
I'd like to point out that Healthy Kids Colorado 2021, the survey is taking place in the Aspen schools in November. And this participates in the entire state of Colorado. Assistant Superintendent Theron Mulberry is in charge of Healthy Kids Colorado locally. And together with him, because I'm chair of the Aspen Elks Drug Awareness, we wrote an op-ed in the Aspen Times 2 weeks ago on this topic. Mm-hmm. There were 29% more overdose deaths in Colorado in 2020 related to the pandemic in part. So this is a time to be aware of vaping and other activities, particularly in kids and adolescents.
Great, thank you, Dr. Kurt. Also, I just wanted to say there's a tobacco campaign, tobacco and vaping campaign organization that has contacted us and would love to present at some point if this board, hopefully in a future board meeting, will have time just to talk about the tobacco campaign, and I would support that. We've heard from them before with the BOCC, but it certainly would be okay, and I'll circle back with Jordana regarding the tobacco campaign, tobacco nicotine vaping campaign, which we were all active in before the pandemic. So it might be good to get us back on that track, and maybe refreshing to pick up some of those things again.
And that was a presentation, Greg, that came here just a couple months ago as well.
And am I blanking? Yeah, sorry if I blanked that. I'm mixing my years. Okay, we're at time, folks. It's 2:30. I see there's one more question from Ann.
Yeah, not a question. I was just going to say, in terms of the tobacco and vaping, we can always review what the city has done for that, because we've done quite a bit in that area, and happy to share that with you.
Great. Maybe at our next meeting, we'll have some time blocked out for that and round robin. If not on the agenda, let's put it on the agenda so it doesn't get shuffled aside. Okay, with that, I need a motion to adjourn, or maybe I don't, but if anybody'd like to make one. I see Dr. Kurt has a motion
I'll
to
second
adjourn.
it.
Seconded by Krista. All in favor? Raise your hand. Thank you. Appreciate it. We'll see you next time.
Krista,
Thank you.
congratulations. It's from Ann.
Thank you.